Hi, it's Dr. Fraser talking about one of the most exciting tools we now have in longevity medicine, which is the GLP-1 or dual GLP-1 GIP receptor agonist. These are drugs like Ozempic, Wegovy, Mounjaro, Zepbound, which when used in non-diabetic, metabolically healthy or health-seeking individuals, these medications are associated with an impressive list of benefits that go far beyond simple weight loss. Many of my patients also have weight to lose and insulin resistance, which when addressed adds to these benefits. Here's what the latest data shows, and please look at the show notes for links to references. So to begin with, significant improvement in body composition with dramatic fat mass reduction with relative muscle preservation when paired with resistance training and adequate protein. The next thing is marked reduction in cardiovascular events, up to 20% lower risk of heart attack, stroke, and cardiovascular death. The next thing is, as you would expect, lower incidence of type 2 diabetes, up to a 73 to 94% risk reduction. Pretty good. Decreased progression of chronic kidney disease. So we have nice evidence for that, and we'll have the references in the show notes also. Improvement or resolution of non-alcoholic fatty liver disease, now our most common cause of liver disease, and also metabolic dysfunction-associated fatty liver. So this is all something where you can get all these benefits from this agent. We see emerging evidence of risk of reduction of dementia by 45% and likely benefits for other neurodegenerative diseases. There's observational data and mechanistic studies available, and I've put some links to those. There's lower rates of several obesity-related cancers, as cancer actually goes up by about 30% just with obesity. So just with treating that, you're reducing that risk of death and disability. So overall reduction in all-cause mortality, large cardiovascular outcome trials. And despite all these benefits, these are powerful drugs, which may not be right for everyone. General contraindications in situations where we do not prescribe these medications include a personal or family history of medullary thyroid cancer or multiple endocrine neoplasia syndrome type 2. History of pancreatitis is a relative contraindication. Problems with your gallbladder or problems where your stomach slows down with something called gastroparesis. And sometimes also severe psychiatric disease history, especially if there's an eating disorder. We really would not want to give you this. Being pregnant or planning to become pregnant would be another time that we would not give this, or with breastfeeding. Type 1 diabetics, especially even other diabetics who have a history of diabetic ketoacidosis. Somebody who has a very low body mass index where they don't have any significant fat to lose, we would be worried about causing them harm and worsening their overall body composition. So let's jump into the questions. Ones that I most often get asked.
Will I lose muscle if I use these medications?
This is a great question. In the original trials that the manufacturers did with these drugs, we saw about 35 to 40% of the weight loss was lean mass, which is pretty similar to people just losing weight with caloric restriction alone. For healthy body composition, most people are 70% plus lean body mass. So overall, you would be improving your body composition if you only lost 35 to 40%, but still not ideal. What we like to see people do is have patients do resistance training 2 or 3 times a week and eating adequate protein, and lean mass tends to drop maybe 10 or 20%, which is a marked improvement in body composition, and much better than the diet-only approaches. And also the other critical thing is to make sure that any weight loss is done very slowly. If you lose fast, you're going to be much more likely to get into trouble with muscle preservation. And muscle preservation is absolutely achievable, but an important tip, as mentioned, is lose weight slowly and certainly hold it to less than 1 pound per week. Ideal is probably half a pound per week, along with the weight training.
Do I have to stay on it forever?
No, you don't. I think that with most longevity treatments, the benefit has to do with the length of time that you're on the medication. And it is something where if you stop taking the medication, you may end up having a reversal of all of the benefits. So it is something where the benefits are probably not only from the weight loss, there's probably some other effects of the medication. So in general, I'd encourage people to try and maintain a low dose once they're at a stable body weight that they're happy with, just to maintain that. but don't necessarily come off the medication unless there's an issue with expense or side effects.
What about the nausea and GI side effects?
About 40 to 50% of patients experience some nausea, usually in the first 4 to 8 weeks. We eliminate almost all of this by starting with the lowest possible dose, which would be 0.25 milligrams of semaglutide or 2.5 milligrams of Tirzepatide, and increasing it very slowly, certainly much more slowly than what the manufacturer recommends. And sometimes looking at doing that every 6 to 8 weeks instead of every 4 weeks. Taking the injection at night and eating smaller meals and staying hydrated also helps tremendously.
Will my insurance cover it if I'm not a diabetic?
Very unlikely that they will. Most commercial plans still require a type 2 diabetic diagnosis, and sometimes they'll do it purely for being overweight, such as having a body mass index of greater than 35 with some comorbidities, and sometimes even greater than 30. This is a rapidly changing area, as there also are cardiovascular and kidney benefits that are coming out in literature, but it is something where almost all longevity patients pay cash and tend to have us prescribe the medication to a compounding pharmacy.
Can I combine this with male or female HRT, growth hormone releasing factors, rapamycin, or other longevity therapies?
Absolutely. Actually, synergistically in most cases. Lower visceral fat improves hormone sensitivity, often raising natural testosterone and IGF levels. Many of our male and female patients see better body composition and energy when we optimize hormones and use GLP-1s and GIP therapies together under close supervision. The bottom line with this is when used thoughtfully in the right patient, these medications appear to be remarkably good longevity medications. Until next time, stay healthy, active, and safe.